tremendous vision and leadership on this issue. And my partners on this legislation, Senators Hirono and Duckworth, and Senators Kane and Baldwin, my colleagues on the HELP Committee for their continued support. And thank you to the tremendous partners here today who are fighting for reproductive justice and freedom each and every day. Minnie Timaraju, President of Reproductive Freedom for All, Virginia State Delegate Sia Price, and Karen Stone, Vice President of Public Policy and Government Relations at Planned Parenthood. Just 2 years ago this month, the Supreme Court majority overturned Roe versus Wade. In doing so, this extremist Supreme Court overturned decades of settled precedent to strip away the constitutional right to abortion. On June 24, 2022, Americans had one less right than they did on June 23, 2022. But Dobbs wasn't just about abortion. It was an opening salvo in Republicans' anti-freedom, anti-rights war. In his concurring opinion in Dobbs, Justice Clarence Thomas distilled the threat to American freedom. He outlined a long-held MAGA extremist belief that Americans had too many privacy rights under the United States Constitution, that the Supreme Court erred in recognizing those rights, and that the court should take them away. The rights he was talking about, the right to marry who you love, and the right to contraception. Dobbs was an invitation to continue attacking American freedom to make decisions about health and personal freedom. And this extremist court put contraception on the chopping block. And so the MAGA extremists, offended by American freedom, began their march attacking Americans' freedom. Texas Republicans gutted Medicaid coverage of emergency contraception. Idaho Republicans blocked health clinics and public schools from providing contraception. Republicans, governors are vetoing state efforts to protect the right to contraception. In June of 2022 and 2023, Senate Republicans blocked my attempts to pass the Right to Contraception Act on the floor of the Senate. 195 House Republicans voted against the Right to Contraception Act. In outlining the Trump 2025 agenda, if he wins, the Heritage Foundation made one of their goals restricting access to contraception. It's in the Trump 2025 agenda. And when asked whether he supports restrictions on a person's right to contraception, Trump said he would have to look at it. Democrats and the vast majority of Americans don't have to look at it. It's settled. A 2023 poll found that 88% of Americans said birth control was morally acceptable, including 86% of Republicans and 93% of Democrats. We know contraception isn't contraband. We know that access to contraception, the pill, Plan B, IUDs, are essential for people's health care. We know contraception is fundamental to economic and social freedom. And after all, it was the Biden administration that made sure birth control pills are available over the counter. We are the ones fighting for greater affordability and better access to care, and we are the ones fighting to protect this important right by blocking Republicans' relentless appetite for inserting themselves into Americans' private lives. I introduced the Right to Contraception Act with my partners in reproductive freedom, Senators Hirono and Duckworth, as our own prophylactic to extremist attacks on contraception access. The Right to Contraception Act guarantees Americans have the freedom to get contraception and for health providers to give it. The right to contraception free from federal and state governmental threats, and the dignity to choose what contraception works best for them and their families. The Right to Contraception Act would help us unwind decades of reproductive coercion facilitated by bad Supreme Court decisions, attacks on reproductive justice, and divestment in the health care of Black, brown, immigrant, LGBTQ, disabled, low income, and rural Americans. It would help us. It would help us to undo the legacy of forced birth and medical experimentation on enslaved women, involuntary sterilization of disabled Americans, and the coercive testing of birth control on Black and Puerto Rican women. Passing the Right to Contraception Act would be a clear and unequivocal statement for health freedom and for justice for everyone in our country. Republicans will try to say they support the right to contraception. Well, we are calling their bluff yet again by bringing this bill up for a vote this afternoon. And this vote poses one simple question. Do you believe Americans' access to birth control should be protected, yes or no? And each senator that votes no will be on the record on what they support, contravening Americans' right to contraception. A no vote will show the American people how extreme and out of touch their views on reproductive rights are. A no vote will prove what the GOP really stands for, gutting our protections. The American people will remember who protected their reproductive rights today. They will remember who fought for their freedom today. They will remember who voted yes to the Right to Contraception Act. So we thank all of you who are here today, who are supporting this effort. It is historic. The Dobbs decision was a preview of coming atrocities in protections for the American people. That's why we're here today. And now I give you our great leader in the United States Senate, the great Chuck Schumer from the state of New York.
Well, thank you. Thank you, Senator Markey. I want to thank Senators Markey and Hirono and Duckworth, who have been leading the charge on this issue for many, many, many years, actually. And my other colleagues who are here, Senator Baldwin, Senator Durbin, Senator Kane, Senator Hirono. Oh, I mentioned her. Well, she deserves 2 mentions. And our great leaders, Minnie Timaraju from the President of Reproductive Freedom for All, the Virginia State Delegate Marcia Price, Senator, and Karen Stone, the Vice President of Public Policy for Planned Parenthood. And let me start with a disturbing statistic. According to a recent poll by the Kaiser Family Foundation, 1 in 5 U.S. adults worry that the right to contraception is under threat. This is America, 21st century, 21st century. What century are we? 21st century. We're 20, all those twos, 2022, 2023, the 21st century, and we're still worried about this. And in the same poll, less than half said they felt the right to use birth control was secure. Less than half of Americans in the 21st century are not sure they have the right to birth control. That's more people than live in Florida or Texas or California. It's astounding that people have to worry about it. Make no mistake about it. How did this happen? Make no mistake. Americans' uncertainty about using birth control is one of the many, many shameful consequences of overturning Roe v. Wade. So for those who may say that contraception contraception is not under fire, I have 2 questions for you. What about the influx of all the efforts across the country trying to make it more difficult to access contraception? Ask the governors in states that have vetoed legislation. Ask the legislators who are putting forth legislation in so many states to curtail the right. It is under threat. And also, after years and years of being told that Roe would be protected, is this a gamble any one of us should be willing to take? They said, oh, don't worry. Everyone said, don't worry about Roe. Well, we have real worry about Roe after Dobbs, more than worry. We have similar worries about contraception if we don't do something about it. This is the mess that Donald Trump and the MAGA Supreme Court and the Republican-led Senate has created. This is the mess that Democrats in the Senate are determined to fix. In short, This is not a show vote. This is a show us who you are vote. Let me say that again. This is not a show vote. This is a show us who you are vote. And the Republicans don't want to show who they really are. But they're going to have to in a few hours. Today we live in a country where not only tens of millions of women have been robbed of their reproductive freedoms, we also live in a country where tens of millions more worry about something as basic as birth control. That's utterly medieval. It's sickening. It should never happen here in the U.S., but because of Donald Trump, the hard right, and the Republican Senate, which is willing to go along with them, it's reality. But today, fortunately, the Senate has the chance to protect reproductive rights by advancing the Right to Contraception Act. I want to thank all my senators, particularly our women senators, who have met day in and day out fighting for us on this issue. The Right to Contraception Act says if you want to access birth control, if you're a health care advocate, provider wanting to prescribe birth control, the government has no right to interfere. Now, doesn't that seem like common sense? After all, birth control is something over 90%, 92% of Americans support. Of course, we're already hearing the same predictable, tired, unpersuasive retorts from the other side, that this vote is unnecessary, that birth control could never possibly be at risk, that this is much ado about nothing. That's not true. As I said, go ask the people of Virginia what they think after their Republican governor vetoed a bill that would have protected contraceptives at the state level. Go ask the people of Nevada what they think after their Republican governor also vetoed a bill to protect birth control. Or to those who say birth control will never fall at risk, go ask the people of Arizona or Florida or Idaho or Iowa or Missouri. In each of these states, Republican governors, Republican legislators are on record blocking protections for birth control access in one form or another. We're kidding ourselves if we think the hard right is going to be satisfied simply after overturning Roe with the horrible Dobbs decision. Remember, people said before Dobbs that Roe would never be overturned, and of course, unfortunately, it was by a right-wing MAGA court appointed by Donald Trump and our Republican colleagues here in the Senate. It is utterly unacceptable for Americans to even question whether or not access to birth control should fall at risk. We can eliminate that worry in one fell swoop by passing the Right to Contraception Act. Thank you, and I guess it is my turn to honor one of our really great fighters for women's rights in general, for human rights in general, and for the right to contraception, who's been working on this along with Senator Markey for such a long time, as I call her Maze, but it's the great Mazie Hirono from the state of Hawaii.
Thank you. Thank you, Chuck.
Thank you, Eddie M.
It's hard not to observe that the Republicans have an obsession with power and control over women. Remember the days when women couldn't vote, when women couldn't own property, when women couldn't even open a bank account? The Republicans want to get back to those days when power and control didn't flow to women in this country, but to them. So in a month, it will be 2 years since the Dobbs decision and all of the chaos that followed that decision. And now something as fundamental and common sense as access to contraception is on their hit list. Justice Alito respects his wife to her right to fly a flag upside down, but he has no problems telling millions of women in our country what to do with our bodies. Obsession with power and control over women. That is what's happening. And then Justice Thomas, as my colleagues have said, he said he would like to revisit Griswold, a 1965 decision of the Supreme Court that dealt with contraception rights. And whenever a Supreme Court justice, especially in the MAGA far-right justice, says he wants to revisit a case, you can bet that he's looking to overturn. So this is real. And as mentioned, There are states that are already making sure that access to contraception is not protected. So the states are mentioned: Arizona, Oklahoma, these states. And, just to let you know that every opportunity, every way that the MAGA Republicans and their supporters on the Supreme Court will look to anything that they can to restrict our right to our freedoms, is that the two justices, Alito and Thomas, have also talked about the Comstock Act, a Civil War era law that could be used to restrict access to reproductive care nationwide. Virginia, Arizona, Oklahoma, other states, they are doing their best. Republicans in those states are doing their best to deny access to contraception. So Democrats know that women, it is our decision, our freedom, to decide when to have a child, family planning, all of that. That means that we should have access to contraception. In fact, just as I was walking here, a reporter asked me what I thought about the Republicans saying, oh, they can't support this bill because it's too broad. And I said, what is so broad about it? It simply says that we have a right to contraception, Americans, all of us, and that the providers also have a right to provide it. What is overbroad about that? I think it's really pathetic that the Republicans, the MAGA Republicans and their ilk, are looking for every excuse to not vote for a bill, this bill, the Right to Contraception Act, that will really provide the freedoms that they are so busy taking away in their obsession with wanting power and control over women in this country. So the Democrats are going to continue to fight back, and that's what we're doing today. I'm glad to join all of my colleagues here. And I think we're going to hear from the wonderful Tammy Duckworth. There you go.
Beautiful.
And I'm taller than most people think. I don't stand very much, so people are always surprised. Good afternoon, everyone. Thank you, Senator Hirono. It's great to be here with you all today. And let's be perfectly clear. Birth control is health care. But in the nearly 2 years since the Supreme Court threw out Roe v. Wade, we've seen extreme MAGA Republicans across the country work to roll back health care and tear reproductive freedoms away from Americans. And as a result of these barbaric efforts, birth control, including Plan B, are under threat. That's the nightmarish reality that millions of Americans are living in a post-Roe world. And it's not a hypothetical future. It's what's happening today, every day now in this great nation. Because they don't care that birth control is safe, effective, and an important part of reproductive care. They don't care that contraception helps millions of women treat conditions like endometriosis, PCOS, and even helps to decrease the risk of certain cancers. They don't care that they are making it even harder for Black and brown communities, LGBTQ plus Americans, people with disabilities, and other marginalized communities from accessing the health care that they desperately need. And they don't care that access to contraception bolsters military readiness. If they did, they would not have cheered when Roe v. Wade was overturned 2 years ago this month. That's why I am incredibly proud to join Senators Markey, Hirono in pushing for our Right to Contraception Act, which will be brought to the floor for a vote today. What this legislation would do is, in the name, it would codify every American's right to access birth control, no matter their zip code, and prohibit any state from enacting laws that would infringe upon that right. Because the freedom to decide if, when, and how someone becomes a parent should belong to Americans, not Republicans. Our legislation also establishes a right for doctors to provide contraception without fear of being prosecuted or thrown in jail. The decision to seek out and use birth control is an extremely personal one, and every doctor should be able to discuss resources and options with their patients to help decide which form of contraception might be the best form for them. Many Republicans will say we're being overzealous and that there's no real threat to birth control. Well, they also said we were overreacting when we said Republicans were coming for Roe. They said we were overreacting when we said IVF and the right to build our families and on our own terms would be next after the Dobbs decision. But this is not an overreaction. This has been Republicans' plan all along. When we vote on this bill today, we'll make it clear once and for all who supports the freedom of every American to access contraception if and when they need it, and who plans to continue their right-wing attacks and exert further control over women's bodies. If Republicans were really pro-freedom, they'd help us pass this important legislation to protect the freedom of every American to decide what happens to their own bodies, their own careers, and their own futures. So today, I will vote yes to pass the Right to Contraception Act to protect our rights. Thank you. And now I am very proud to be followed by the chairwoman of the Tammy caucus in the Senate, Senator Tammy Baldwin.
Thank you, and good afternoon, everyone. When we talk about reproductive care, Americans have been crystal clear about what we want. We want the right and the freedom to control our bodies. More than 60% of Americans say abortion care should be legal in all or most cases. 2/3 of Americans support a law guaranteeing a federal right to abortion, and a whopping 8 in 10 Americans say access to contraception is deeply important to them, including over 70% of Republican voters who hold a favorable view of birth control. Unfortunately, these rights are not certain anymore. This activist Supreme Court that threw out 50 years, almost 50 years of precedent in overturning Roe versus Wade and ripped away women's reproductive freedoms, the consequences have been dire. Depending on where you live, politicians have forced women to remain pregnant with unviable pregnancies. Prosecutors can go after doctors for doing their jobs and providing basic reproductive care. Judges have told women they must bleed for days or be on the brink of death before their obstetrician gynecologist can legally end their pregnancy. Women cannot decide what is best for their bodies or their families. This was a reality for those of us from Wisconsin for 15 months when women were sent back to live under a law that was passed in Wisconsin in 1849, 1 year after statehood. It is widely viewed as a criminal abortion ban, and it one that I might add predates the Civil War and certainly predates women having the right to vote. Sadly, I have little or no faith that this activist, extremist Supreme Court is done with this mission. They invited people to challenge the law that upholds marriage equality. So I led a charge to protect same-sex and interracial couples and earned bipartisan support for my Respect for Marriage Act, which was signed into law. Now it's time that we do the exact same thing to protect contraception, because I will not just sit around waiting for the day that this Supreme Court takes away another one of our rights and freedoms. For my Republican colleagues who say women don't have the right to control their bodies when it comes to abortion care, then shouldn't we at least ensure more Americans can access birth control and get pregnant on their own terms? For my Republican colleagues who say this is just a messaging vote for Democrats, it doesn't have to be if you stand with the vast majority of Americans who want to protect the right to access contraception. This bill safeguards that right, and it's that simple. I hope my colleagues will join me and the vast majority of Americans and support keeping contraception legal and available. Join us to pass the Right to Contraception Act. And next, Tim Kaine. Here, have the podium.
It is great to be with you. Thank you so much. This should be the easiest vote that the Senate will cast this year. If senators listen to the American public, as Senator Baldwin and others have mentioned, overwhelmingly the American public support the notion that you should be able to access contraception and a provider should be able to provide contraception. It's so easy. If Republicans just listen to their own constituents, say they ignore what Democrats think and they ignore what independents thinking, just listen to Republicans, it's clear they should vote for this bill. Now, there are some who say, oh, you know, it's not needed. Well, let me tell you, and I'm going to introduce next a speaker who's going to tell you why it's needed. In Virginia, my state legislature just did the equivalent of this a few months ago, a right to contraception act that they placed on the governor's desk. As the bill came through both houses with narrow Democratic majorities, only a tiny handful of Republicans showed that they were even listening to their constituents to vote for this. Our governor vetoed the bill. You would think it would be so straightforward. Just listen to Virginians. What are Virginians asking you to do? They're asking you to support the legality of contraception. Our governor vetoed the bill. And then when it went back to the legislature for the veto override, even some of the Republicans who had joined in the effort to support the right would not stand up to the governor and vote to override the veto. So for those who are saying, oh, this is a non-issue, go back and read the Dobbs decision. Read the invitation that was made by the court to go after contraception. Look at what states are doing to in vitro fertilization, going after IVF. Could there be anything more pro-life than IVF? And yet Republican legislatures and Republican governors are going after it. We need to protect this fundamental right. Now I bring up a wonderful fifth-term member of the Virginia House of Delegates who was the lead House sponsor of the Right to Contraception Act in Virginia. And does she, Sia Price, have a story to tell you? Sia. Thanks. Yep.
Good morning. And thank you for having me here. My name is Sia Price, and I represent my hometown of Newport News, Virginia, in the House of Delegates. I would like to thank Senator Markey for inviting me to join this group today as you all head toward today's crucial Senate vote to codify the right to contraception into federal law. And I always want to thank my senators, Kaine and Warner, for being co-sponsors of this important legislation. I also want to thank the advocates on whose shoulders we stand that helped access to contraception become so normal for my generation that for better or for worse, we took the Griswold and Eisenstadt Supreme Court cases for granted. For some, 1965 sounds like a long time ago, respectfully, like some distant history, because it was before even having Supreme Court cases in front of Justice Thurgood Marshall or Sandra Day O'Connor as they served as first on the bench. And since then, we've had major scientific and technological advancements in contraception, and its accessibility has helped millions in our nation. And respectfully, when people take the pill, use a condom, or get an IUD, the last thing they are thinking about are United States senators. But yet, here we are today, because on June 24th, 2022, we got that wake-up call that we can't take anything for granted anymore, and that some are working fervently to take us back to 1965 or before. The threat is real from at least one Supreme Court justice to elected officials on the federal and state levels and political operatives on social media platforms with misinformation, disinformation, and propaganda against contraception. As the collective effort ramped up to attack contraception, Virginia Senator Ghazala Hashmi and I sponsored the Virginia Right to Contraception Act to fight back. The bills would have simply enshrined the freedom in our state code. We introduced this bill because everyone should have the full scope of available options for reproductive health care and family planning services. But our governor in Virginia, who said from his own mouth, let me be clear, crystal clear, I support access to contraception, went on to veto the bill and block the legislation. Governor Youngkin unfortunately taught us again that actions mean more than words. As some elected leaders seek to control people's bodies and poke around in people's bedrooms, the part that some refuse to admit is the real-life impacts of their actions. We can't forget that contraception is critical for both family planning and a variety of health conditions, including my own, polycystic ovarian syndrome. For see, I could not even be here today without my IUD. I could not do the work of a delegate without my IUD. And there are millions of Americans just like me who have no semblance of quality of life without our contraception. Virginians may still have hope since we will soon have a new governor due to our own state term limits, but other states may be stuck with governors like him for years. Governors out of touch with the majority of the country who believe that people should have access to contraception and want the right protected. So that is why I am here today, to lend my voice as part of the overwhelming majority of Americans who support this bill, to call on Congress to pass the Right to Contraception Act. If state leaders, especially in the South, continue to fail us, then it is up to Congress to act. This bill is needed because the threat to contraception is real, from the very people saying that it's not. And this bill is needed because people who can get pregnant do not owe our fertility to anyone else. Each senator today will have the opportunity to tell us exactly where they stand on this issue. The American people are watching. Thank you.
Thank you. Thank you for telling us your powerful story. Thank you, Senator Kaine. And next we're going to hear from the chairman of the Senate Judiciary Committee, Dick Durbin. Welcome, Dick.
Thanks, Ed. Markey, Mazie, Hirono, and Tammy Duckworth for leading this effort. MAGA Republicans insist they're for freedom. What about the freedom to decide the future of your family and whether or not you're going to have a planned pregnancy? That is so fundamental and so basic. They say they're for protecting privacy. They're talking about repealing Griswold, which was one of the most basic guarantees of privacy that we've seen by the Supreme Court. I want to thank my colleagues and just briefly say the issues of freedom and privacy are worth fighting for, and this vote today is going to be a record vote. Republicans cannot escape. Vote yes or vote no on the right to contraception. I'm voting yes.
Thank you. Next, we're going to hear from Minnie Timaraju, the president of Reproductive Freedom for All, national leader.
Thank you. And I know the chairman's leaving, but I also want to give credit to Senate Democrats and the chairman and leader for the record number of judicial nominations and confirmations. That is an incredibly important path for us to restore reproductive freedom in all 50 states. So I want to thank him as he's walking out. So look, the Dobbs ruling not only gave the green light to anti-abortion extremists to begin enforcing bans, but it sent a clear and terrifying message to Americans. Our freedom to determine if, when, and how to start and grow a family is on the line, and you've heard that from everyone up here today. You've heard about Justice Thomas and his concurring opinion in Dobbs, where he specifically called out the right to contraception and questioned it. So, for folks who think we're being alarmist, let's be clear, this court has signaled what direction they're headed. And we've known for a very long time, particularly those of us in the reproductive freedom, rights, health, and justice movements, that birth control was always the end game. The extremists who control the Republican Party have always been after birth control. That's why they've hampered efforts to make birth control over the counter. They've hampered efforts to make birth control accessible. They've gutted family planning funding. Let's be clear who's done that. It's been Republicans, and they've been doing it for decades. So this is not new, but this is frankly appalling, and this is our chance to get them on the record. And this is a really important day. So look, we can't take this for granted. Barriers to birth control, as we know, already fall hardest on folks who are facing the most significant barriers to care. That's people of color, young people, LGBTQIA people, disabled people, folks in areas that are hard to reach, rural areas. These are Democrats and Republicans. These are independents. These are unaffiliated voters. And many of us, like the delegate talked about in her powerful story, many of us use birth control for healthcare reasons. I myself used birth control from a very young age because I suffered from endometriosis and uterine fibroids, which created infertility for me and my family. And thank God for reproductive freedom in this country that I was able to form the family that I have today. So it's personal for me. It's not just as a leader. But look, these anti-abortion extremists, they don't care about the consensus of Americans. As Senator Hirono really powerfully pointed out, it's really about power and control. And when we talk about the generations of women in this country who didn't have access to birth control, we're just talking about my mother's generation. 1965. It's not that long ago, but talk to your mom. Talk to your grandma if you're Gen Z. Talk to your grandma. Ask her, when did she have the ability to access birth control? When did she have the ability to make those decisions? It was not that long ago, and that should really be a wake-up call. So look, Donald Trump has made it very, very clear that he would consider restricting access to contraception. He did exactly that while president. And should he win in November, he has the blueprint to further decimate reproductive health care, including birth control. Project 2025, the conservative plan created by Trump officials, his advisors, includes language and policies that propagate the belief that life begins at conception. And you know what that means? That means coming after birth control. So the Dobbs decision affirmed that these are not empty threats. They promise an increasingly extreme minority. We must act now to protect access to contraception. So we're grateful to Leader Schumer for bringing this to a vote, Senators Markey and Hirono for leading on this bill, and all of our champions here today in Congress who are going to fight for it. It's really, really urgent. Let's call them up, call it like we see it. Let's hold them accountable. And with that, I'm going to ask my good friend Karen Stone from Planned Parenthood to join us.
Beautiful. Thanks, Minnie. Good afternoon. My name is Karen Stone, and I'm Vice President for Public Policy and Government Relations at Planned Parenthood. And I'm here today on behalf of hundreds of Planned Parenthood affiliates across the country and the over 2 million patients they serve to say thank you. Planned Parenthood Federation of America is grateful to Senators Markey, Hirono, and Duckworth, Senators Kaine, Baldwin, Durbin, and so many others for their leadership on the Right to Contraception Act, and to Leader Schumer for bringing it to a historic vote today. This bill is a critical piece of legislation to protect access to birth control. The fight for birth control access is a long-fought effort, and we appreciate your commitment to our rights. We can't talk about birth control without talking about freedom. Birth control is essential to reproductive freedom, the freedom to make decisions about your own body, life, and future, the freedom to decide when, if, and how to become a parent, the freedom to be equal participants in society. That's why it is critical that we ensure that people have access to the birth control they need alongside other forms of preventive care. But we are here today because this essential freedom is under attack. The Supreme Court's devastating decision just 2 years ago to take away the federal right to abortion has only emboldened legislators who want to take away many critical and time-sensitive reproductive health care services, including the right to birth control. Let me tell you, they will not stop. And in the face of these efforts to roll back our rights, senators must vote yes to protect the right to birth control. Barriers to birth control access fall hardest on those who already face significant barriers accessing health care, including those working to make ends meet, young people, LGBTQ plus people, disabled people, and people of color. And our country has a long history of denying reproductive freedom through racism, discrimination, and coercion, a long history of stripping people with disabilities and Black, Brown, Indigenous, and immigrant communities of their rights. We must work to improve access to the full range of birth control methods, including emergency contraception, so that all people can make decisions about their own bodies, lives, and futures free from stigma or coercion. The vast majority, the overwhelming majority of people support birth control access. Everyone should be able to get the birth control they need when they need it, free from political interference. All sexual and reproductive health services, abortion, contraception, gender-affirming care, maternal health care, and much, much more need to be protected, and access must be expanded. So now is the time to pass the Right to Contraception Act, and we'll continue to fight until all of our fundamental rights and freedoms are protected, restored, and expanded.
Beautiful. Thank you. Are there any questions? Yes, sir. Well, the same Republicans were saying the same thing about the Roe versus Wade. And then it got repealed in the Dobbs decision. And Justice Thomas, in his concurring opinion, said that the Supreme Court should now take up contraception as well. And across the country, from Virginia, Arizona, to Iowa, to Idaho, at the state legislative level, they're moving to put restrictions on contraception. So it's just the opposite. Contraception is under assault in our country, even though the Griswold decision is now 59 years old. So we're going to have Contraception Day here in the United States Senate, and everyone's going to be put on record. And if they say it's not under threat, then they should all just vote yes in order to reaffirm that right. Questions? Yes, ma'am.
The NRSC issued a memo for GOP candidates saying that they should say that they support birth control and that they should support Joni's bill that she introduced yesterday on contraceptives. And I wanted to get your thoughts and the advocates' thoughts on that.
Well, that's the same thing that Governor Youngkin said in Virginia. Then he vetoed the contraception bill. So let's see what they do out here today. Let's see if they vote for contraception. We're going to give them a chance. Up or down, yes or no. Today is Contraception Day in the history of the United States Senate. Yes, sir.
Some of what we're hearing from Republicans is they feel that this would force religious organizations with conscious objections to provide these services. Do you see that as a problem, and is that true?
First of all, it's not true. All this legislation does is to give an individual the right to access to contraception and the right for a provider to be able to provide contraception for individuals. There is no religious issue that's part of this legislation at all. Questions? Thank you all so much for being here. Much appreciated. Thank you.
Thank
Wow.
you. So grateful.
So the roll call controls out.
Oh,
When the bells go off. Thank you. Thank you.
You were
great.
fantastic.
Yeah, you brought.
So good.
You bring the Youngkin hypocrisy.